NHF. NHF.
Well, for simplification, we use the modified Manchester classification. And this usually involves stage 0, which means it's a non-palpable lump that is detected only on mammogram. Stage 1, which means a small lump, usually less than 2 centimeters, and that is usually palpable, and that has a very good prognosis when it is treated at that stage. That gives you about a 95% 5-year survival. Stage 2 is when it moves from about 2.5 to 5 centimeters, and this usually may cause some amount of discomfort in the breast. They may or may not have palpable nodes within the axilla or armpit. And these stage 1 and stage 2 are usually curable breast cancer, because even at stage 2 we can get an 85% 5-year survival. When it reaches stage 3, where there is a very large lump in the breast and it's usually fixed to the tissues of the breast or to the chest wall, or it may have very large nodes in the axilla which are fixed. This is usually not a curable cancer, but we can delay the progression of the disease as long as the patient is responding to treatment. Stage 4 usually means the breast cancer has moved beyond the breast, and usually it involves metastasis to the bone, to the liver, to the lung, and also to the brain. And this cancer is usually very serious with a very poor prognosis and survival about 10 to 15% 5-year survival. Well, the recommended frequency of mammograms usually, as I said, begins at 40 years old, and the mammograms should be done at least for baseline study, and therefore the physician will determine if the patient needs a yearly mammogram or 2-yearly mammogram. This is determined by the features of the mammogram and also taking into account the family history and also the patient's symptoms. It is said that the lifestyle factors do play a part in breast cancer occurrence. Usually the women may be obese, they smoke or drink alcohol, they sometimes lack exercise, and also there are some professions that seem to have a higher risk. If they are exposed to radiation or certain types of plastics, they say that they may have an increased risk of developing breast cancer. This is also in keeping with the patient's family history, or whether or not the patient has a positive family history of a first-degree relative, whether mother, sister, or aunt who may have breast cancer. Other factors that may also influence the occurrence of breast cancer are previous surgery in the breast, benign surgery, or if the patient has previous breast cancer in the other breast. So all those factors increase the risk for breast cancer.
NHF.